Greetings, everyone. I'm Dr. Muthoni Karanja, currently the Head of Directorate for Healthcare Professionals at Kenya Human Resource Advisory Council, and I'd like to present my project on bridging the world of leadership and well-being, with my case study being the health professionals in Kenya. I will take you through a pathway of fostering a culture of sustainable success towards empowering healthcare workers and advancing universal healthcare. So, on matters of challenges, solutions, and outcome, is that the importance of healthcare leadership and well-being has been on the forefront from a global perspective, and that Kenya faces a unique challenge of limited research, inadequate well-being initiatives, and gender disparities, where the challenges I've stated and the solutions are on the slide. On matters of the outcomes, I managed to look at short-term, mid-term, and long-term, with the long-term being empowered healthcare workforce. On the milestones I managed to undertake in this particular project was the stakeholder mapping and the stakeholder engagement exercise, where some of the aspects were included in the first ever National Human Resource for Health policy. I also managed to do an assessment which I conducted online on leadership and well-being, and I'm currently working on the disseminations of findings to various stakeholders, which will serve as a platform for policy advocacy. I plan to leverage on my current position and the organization also, to strengthen the existing frameworks that we are currently doing. So some of the survey findings, the highlights is that there was a 100% response rate, and I'd like to thank all the stakeholders who took part in taking part in this survey. A significant number of the respondents were from the public sector at 73%, females at 61%, and an age range of 35 to 54 years. On matters of challenges and opportunities, challenges such as workload and staffing, these are universal across industries, but opportunities like mentorship and inclusivity provide actionable paths forward. The significant overlap between these challenges and opportunities indicate that these respondents are optimistic about resolving these issues if actionable steps are taken. And the bars with the blue on the left are for us to appreciate the challenges, and on the right is for us to appreciate the opportunities in green. These are some of the quotes or recommendations from the healthcare workers who took part in this survey, and I'll just emphasize on mentorship, on mental health, and gender equity. On my reflections on the leadership journey, for me, the leadership journey was a tool for personal and systemic growth. And I got to learn that leadership is a journey and not a destination. And I'd like to appreciate the coaching sessions. Shout out to Irene, Coach Irene. Thank you so much. The learning points for WomenLift Health and the networking, they helped me to transform these challenges into stepping stones. And on the right, I'd like all of us to appreciate this is a blueprint for project transformation. And for me, the blueprints deepen my understanding of systemic challenges and leadership applications in real life scenarios. And something for all of us to reflect is how can we adapt this framework to diversify health systems globally. On matters of shaping the future is that a lot of emphasis has been placed on investment of healthcare leadership and well-being, and this has been a global priority. A quote from Simon Sinek on inspiring action, he talked of leadership is about care and not control, and this is a principle essential for building resilient health systems. And the key core principles here to look into is empowerment, collaboration, and resilience. And I welcome everyone on this particular call and all the stakeholders for collaboration in this project. So moving forward, let's work together to shape the future of healthcare in Kenya. And let's strive to have one empowered healthcare professional at a time. Thank you. Asante.